Welcome to the Think Small podcast, hypergrowth for small businesses. So, what's slowing you down?
Well, hi again, everybody. This is Rob Godlewski, your host of the Think Small podcast. And today our guest is Beau Sorensen. Beau is with First Choice Home, Health, and Hospice based in Salt Lake City, Utah. Beau, thank you so much for joining us.
Great to be here, Rob. Thanks for having me.
Absolutely. So, Beau, the first question I like to ask our guests is, how did you get started in this type of work and what brought you to First Choice?
It's interesting. This is not something I think that is the path of most people. I actually got started in high school. I got interested in, I wasn't even interested in, I was trying to go into medicine. And so I said, what are some things that I can do to become a doctor? And what would look good on a college resume? And so I went through that process. I said, well, I can do home health and hospice. There's an office job. It will work with my with school, and I can kind of do it in and out of what I was doing, which really mattered in high school, getting that diploma first and foremost, and then getting prepared for college. And as I did that, I said, this is a great job. I love it. Continued through college. And when I was in college, I started thinking, I have a lot of time of more school if I want to go be a doctor. I've got 8 years plus residency, and is that really how I want to go forward, or would I prefer to do home health and hospice because I can get into my career a lot sooner, and I love what I'm doing. I love taking care of these people. It's still medicine. It's a little bit different focus, but it was something that I love to do, and so I said, I'm going to stay here and I'm going to do home health and hospice and make that my career. And so I did that. And then over time, I just did different jobs. I'm not a clinician by trade. So I put the clinical things aside and said, I'm going to work on the office stuff. I'm really good at that. I know technology. I know finances. I know how to run an operation. And so I stuck in that path, and then slowly but surely worked my way up until I became the COO of First Choice and have ownership in it now.
Wow, that's an incredible story. So how long have you been with First Choice?
I've been with First Choice for 26 years.
Wow. If our audience could see you, you don't look a day over 32 years old. So
that used to be a problem. It is not anymore.
Yeah, I understand. Well, that's fantastic. So you've been with the company for 26 years. I'm sure you've seen a lot of times when, as most businesses transition over time, there's times of rapid expansion, but there's also times of not only stabilization, but possibly even contraction. And as you were, in the business and running the business, how did you navigate through a period of contraction, not only from the operational side of things, but also from the human side of things?
Contraction is really a challenge. I think it's one of the things in business that nobody wants to deal with, because that means that things aren't going as well as you'd hope that they would. And the way that I have handled contraction is primarily through one of the things that I try to focus on, and that we as a company try to focus on, is making sure that we're taking care of our people. And it's easy to say, okay, we're contracting, we're needing to just go in and cut costs as soon as we can. And instead of doing that, we really focus on how can we take care of our staff and maybe make some changes that we needed to make. And so that could be getting rid of some of the people who aren't necessarily up to snuff, that we said, well, it's okay, we're growing, so no big deal. But and we'll just work with them. So it makes it a little bit quicker pull on that trigger at times, but it also is working with them so that they have a glide path to another job. It's not just saying, okay, we're contracting, you don't have a job, and that happens immediately. It's giving them, in some cases, we've given people 2 or 3 months of time to say, okay, we can handle this. Instead of you coming in and working with us, we're going to pay you, you go find another job. And we'll pay you to go find another job so that you can get in that position, and so that you can have what you need for your family, because we understand that it's a real challenge. Money is tight with everybody, and most people can't handle not being in work for very long. So we want to try to make sure that we take care of our people in that way and hope that it cycles back around and at least, cosmically helps us out in the future.
Wow. That's an incredibly, I'll call it, human approach to dealing with employees during a downturn. I mean, I hate to admit it, but I've been a victim of downturns in businesses before, and faced losing a job and having to find new employment. But your approach is incredibly human, and it gives that employee a chance to understand the change that's about to happen, even though it hasn't happened yet. So I applaud you for that. Talk to us a little bit about then those better times, right? When business seems to be growing or expanding, not only from a service offering perspective, but maybe even in your line of work, a geographical territorial expansion. Talk to us about when that happened. Hopefully it's right now, and how you're navigating the business through that.
Yeah, so we actually are going through a geographical expansion right now, and we have had other expansions. And some of this geographical expansion for us has actually been as a result of merger and acquisition, and that's something that can be a challenge because you're trying to merge two different cultures, and with that, it takes our focus off of some of the things that we're doing in house, and especially the geographical side of things. It adds a new dimension to the business that we haven't had success with before. But we try to take that same human approach that we've taken, with downturns, with these expansions, and saying, okay, we're not just looking for people who are really good at technical things. You can hire a fantastic clinician who will absolutely go out and do every bit of documentation and will take care of the patient in a very clinically competent way, but you can't find somebody who will treat the patient in a way that is human in all of those cases. And so we try to hire for actual workplace fit. And when we do merger and acquisition, we try to merge and acquire with a workplace fit and say, who are people who will fit with our culture, so that we don't have to have a lot of disruption, so that they don't have they don't come in and say, this really isn't the place for me, because we're not going in there to try to change everything that they're doing. Yes, there are a lot of processes that we want to shift. There's a lot of adjustments that we want to make there, but we want to keep the people, because the people side of our business to us is really what we're all about. We're about helping our patients and helping our staff, and making sure that they have the best life that they can possibly have. So that right there is how we inform our expansion. But obviously for myself and for other people who are in executive leadership in the business, it adds a challenge, because now we're having to go to different geographies, and we do try to go there at least once a month, so that we're touching in those areas. We want to make sure that they feel supported. We're having weekly Zoom calls with everybody, so that they're able to see our face, and we're able to chat face to face and get that kind of connection, even though we're not in the office day to day. So that's really what we're trying to do, is build that culture from afar in as good a way as we can. And then, we are also, it's not just lovey-dovey, make sure that everything is kumbaya. It's also making sure that people are hitting results. And so we do talk about results, and we do say, are you hitting your targets? And if not, how can we help? We always try to say, what is it that we're not doing, before we say, what is it that you're not doing? Because we understand that a lot of people have frustrations with the constraints that we put on them. And so how can we release those constraints? What is it that we can do to better support you? And so we focus there first, and then focus on what is it that they're not doing correctly, because maybe we've given them everything in that area, but they're just not hitting those targets.
And I'm sure you've seen that taking that type of approach, right, where you're not telling them, why aren't you making your targets, but why aren't where are we as a leadership team failing you by not making your targets? I'm sure you're getting a lot more buy-in in the performance and the results of the business by doing so, right?
Yeah, we have. We've as we've been doing this, we have really seen a big change in especially I would say in our executive leaders, who are the ones who we're working with day in, day out, and they're very loyal to us as a result of this philosophy that we have, where they have other opportunities, they can go other places, and they choose not to do it, even if the compensation is better, or even if they feel like the work might be a little bit more suited to them, because they are so loyal to myself and to the other owners of the business.
Mm-hmm. Very interesting. So, Beau, I'm sorry for not asking this yet, but tell us a little bit about the organization, the structure, and the services and care you provide for your clients and patients.
Yeah, absolutely. So First Choice Home Health and Hospice is our company. We are in Utah and Arizona. We do home health services. What that is that's taking care of people in their homes so that they can get better. It's often after a surgery, or perhaps they've had a long-term disability or illness, and so we take care of them in that way. We also do hospice services, that is taking care of people who are in the last 6 months of their life. So it's helping them to make sure that they are able to pass away in a way that is as pain-free and dignified and comfortable as possible. And then we have an arm called Horizon Pediatric Home Care, and that is taking care of pediatric patients, people who have long-term disabilities from the time of birth, often up into, sometimes these people live 20, 30 years. And so we're in there day in, day out with them and their families, taking care of them so that they can have the best life that they can have with the disabilities that they're facing.
That's incredible. And I know it's, your line of work can be an incredibly emotional side of providing health care, especially on the hospice and palliative care side of things. But I noticed something on your website, that you actually offer bereavement services. So you'll work with a patient's family. You're clearly working with the patient up until the time of their passing, but you work with a patient's family up to 13 months after the patient's passing. Mm-hmm. It seems like you're going way above and beyond the call of duty there. Tell me how that evolved.
Yeah, so that's actually one of the great things about the hospice benefit is everybody who has hospice through Medicare actually has access to this. Now, it's not all the same with every company, but for the 13 months after your loved one passes away, there you have access to bereavement through the hospice. Now, the way that we do it is we offer social workers, we offer bereavement counselors, we offer volunteers that can come in and help the family with this, either via call, via messages, or via face-to-face if it's needed. We offer bereavement support groups and things like that as well to help people go through this bereavement process. And this family-centered approach is not just after the patient has passed away, it's actually throughout the entire hospice process. So that's one of the great things about hospice is while yes, we're taking care of the patient from a clinical perspective, we're taking care of the family as well from a spiritual perspective and from a social perspective, so that they're able to have this transition that they need as their loved one is moving on from this life.
Beau, I didn't realize that was a standard Medicare, Medicaid benefit, but it just seems that your firm, your organization, really leans into that.
We do. We feel that it is very important to do this, and we feel that it's actually a moral imperative. There's a reason why people have access to hospice and why people need hospice, and it's not just about the patient. Anybody can help somebody pass away, but people can't always help you pass away in a way that feels right to the patient and feels right to the family, and helps with all aspects of that whole transition, because it is a big thing when your son or your daughter or your mother, father, or spouse passes away. You've lived with these people almost your entire life, and there are huge bonds that feel broken. And so that's what we want to. You can't heal death, but you can heal a family through that process, and that's what we really want to do, is make sure that family is healed as much as we can.
That's incredible. Kind of switching gears back to the business aspect of your organization. We talked a little bit about your geographic expansion in the past. But talk to us about, was there a time when you expanded your service offerings to the patient areas that you serve, and how did that go, and how did that add to the revenue of the business?
Yeah, so there were, I would say, three times that we have added service lines to our existing area. And one was when we moved from just home health to hospice. And this was quite some time
Mm,
ago. And we saw it as a natural outgrowth of what we were doing. We had a lot of patients who were on home health who needed hospice services. They weren't improving, they were
right.
declining, and they really needed somebody to take care of them. And so that's why we decided to move into hospice. It was a huge benefit to the company, really, from a bottom line perspective. It increased our overall revenue by about 30% by adding that line of service. From a patient perspective and a patient family perspective, obviously that also helped because they were able to have continuity of care throughout the home health and hospice journey. And that's one of the things that we actually have focused on, is making sure that people have the same clinicians on both sides of the business, so that they have familiar faces coming in and taking care of them, and they're really able to create those relationships that can help a patient and their family through this whole challenge that in their lives. So that was one. Another one was more recently adding that pediatric practice, and that is something that is very different, very unique. But we felt that it was something that was needed in our area. There's a lot of people who don't have access to care, and we thought that this would be a way to help provide that care and help to expand our philosophy and the way that we do care on the home health and hospice side to a whole new group of folks. And we feel like it's been very successful from a business perspective. The margins are small. It's, for each 15-minute increment, which is how we bill in pediatric home care, it's very small margins. But when you
Mhm.
have a lot of hours of care, then small margins can add into something that's profitable. And so it's grown to about 25% of our current revenue as well. So we have a pretty nice blend of different services. And the nice thing about the pediatric practice is that it is very stable. So we have the same people, they're on for years, whereas home health and hospice, we have a lot more churn in our patients. And so as a result, it gives some stability to our clinicians and to our business that the other lines of service don't offer.
So the expansion of services did two things for you. Not only did it increase revenue with existing customers, which, by the way, podcast audience, that's the easiest place to grow, right? Is with your own customers. But it also gave you the opportunity to find new customers with this additional service offering of the pediatric services specifically. Um, so yeah, new services is the easiest place to get new business from your own customers. Fantastic. So Beau, tell me about, what does the future of the business look like over, your next planning period, and whether that's 2 years or 3 years or 5 years, what does the future hold for First Choice?
Uh, I think the future is really exciting for us. We're continuing to grow in our existing service areas, and because our acquisition of new service areas was relatively recent, I don't know that we'll do another one in the next 3 years. We probably will do another one shortly after that. Obviously that could change, but what we're really focused on now is using technology to make things better in people's lives.
Mm,
We try to be at the forefront of technology,
mhm.
and that is helping it so that we can reduce our overall overhead while still serving more and more people. And so we're not looking at this as a way to cut people. We're looking at this
Right.
as a way to make people more effective and to do more with the existing staff that we have. And so we're using artificial intelligence or piloting artificial intelligence in a lot of different areas, including our accounts payable process in our chart audits. And so it's going through and seeing what's wrong with the chart so that we can make sure that we're protected from an audit risk perspective, because insurance companies will come and say, hey, we need your medical records. We want to make sure that those records are accurate and are compliant. And that's one way that we're going to do it. We're also looking at it from an overall patient welfare perspective. There's a lot of new technology that we can have with connectivity, with AI, and with wearables, where we can know what's going on with a patient at any given point in time. And if we can know what's going on with a patient before they get in a crisis, with home health, we're only in a few times a week. Like with pediatric home care, it's different. We're in multiple hours a day, but with home health and with hospice even, it's not every day, all day. And so we don't necessarily know what's going on when we're not there. This new frontier of wearables is allowing us to start to see what's going on with the patient when we're not there. So we can intervene and we can say, let's get a clinician out there before you have to go to the emergency room or to the hospital. And therefore, that's more money for the patient. That's more money for the healthcare system. And it's ultimately, if we could prevent that, that's better for the patient. They're not nobody wants to go to the hospital, and nobody wakes up and says, I can't wait to go to the ER today. This is going to be fantastic. You want to stay at home, you want to be better, and this is a way that we can help to keep our people that we're caring for in better condition so that they're able to live better lives.
Beau, I don't want to say this to sound very businessy or inhuman, but I've literally heard about a very similar approach to what you just mentioned in the manufacturing space. That there's a company out there using manufacturing or highly technologically advanced sensors that predict when a manufacturing part on a machine is going to fail. And so they can work with those customers to prevent a big expenditure of a machine failure before it happens. And essentially, you're doing the same thing with humans, right?
Exactly.
You're preventing a very expensive future surgery or emergency room visit or ambulance ride by being able to see what's going on with that patient, even though you're not there.
Yeah, exactly. And we're also, the other thing that we're doing with it is using it to make sure that people are on the right level of care. So we're saying, are they getting the care that they need? Should they be on hospice? Because there's so many more benefits to hospice than there is to home health. And we want to make sure that we're capturing those folks sooner, because then they're getting the right level of care and not getting dumped or not getting something that they shouldn't have. Because, again, like going back to our conversation about how great it is for the family, we want them to be able to have a longer transition so that it's not just, oh, hey, my loved one is in crisis. We get in there and then a week later they've passed away. That's fine, but that really isn't beneficial to the family. And it's not a beneficial thing for our business, because, you want people to have a great experience with your company. You want them to say, hey, we are so glad that we chose First Choice, and here's why. And you don't get that full experience if somebody comes onto hospice and has passed away within a week.
Sure. So again, that the idea of technology is also definitely applies to your employees, because you work with, I would say, mainly a remote workforce, correct?
Absolutely, yeah.
They're not in your own offices. They're not in your own clinics. They're not in your own hospitals. They're in a patient's home. And there's a whole different set of environmental challenges, you might say, including traffic.
Yeah.
Just, making sure that employee is safe getting to and from the patient's location. So I'm sure that's, the additional technology layers that you're adding on, the employees can see as a benefit, and definitely not an effort to slow hiring or contract employment or anything like that. And you know what, Beau, I'm hearing that a lot from other guests on this podcast, is adapting AI in a way that doesn't reduce employment, but enhances and protects employment. So
yeah, I think that is really important. And especially as you look at the coming demographic wave that's going to happen, and we've seen what happened in Japan and what is starting to happen in South Korea, where you hit this bump where a large cohort of people goes into retirement. And so the workforce contracts, and we have to be able to make sure that we're taking care of all of these people in a way that is still as good as it was when we had a huge workforce. And so, every company should be looking at this and saying, okay, I'm not looking to reduce people. I'm looking at ways that I can make sure my business is sustainable and that it lasts 20 and 30 years into the future. And AI is going to be an absolutely key component to that. just like technology has been over the past 100 years, and just like, computers and all of these amazing advances that we've had in my lifetime have come and added productivity and added efficiency. We're going to see the same thing. It's just going to be, I think, continued acceleration of this, so that we're able to continue to grow and improve and do better.
And you know what? It's not just the larger patient generational sizes that we need to take care of, but the other challenge, kind of on the front end, Beau, is the lower birth rates that some countries are seeing, and we're not going to have enough people to take care of those older generations.
Yeah,
and that's really starting to be a challenge. It may not be a challenge for me and you per se, but in 40, 50 years, it's going to be.
It absolutely will be. And that's something that I'm thinking about with this, because I think that it's important for us to be not just stewards of today, but stewards of the future, and say, how can we make sure that this world is a great place for our children and for their children and for their children. And by making sure that we are preparing for that future, I think that that's one way that everybody can be a good steward of those future generations that are going to come after us.
Mm-hmm. So, Beau, you've been with the business, well over 25 years. When did a challenge come into the business that you or your other leaders on the executive team literally didn't see coming? What was that challenge? How did you react to it? And how did you navigate the business through it?
I mean, one that I think everybody could say is COVID, but so I will set that one aside, because that's everybody had to navigate that. Yeah. Because there is one that is a little more unique to us, and we did have an issue where so we've had a patient electronic medical record for let's see, I mean, I've been here 26 years. We've had an electronic medical record for probably 25 of those years, and this is about 15 years ago now. We had an issue where our medical record system went down, and all of our patient data was deleted. And it was not a ransomware attack. It was an error with the computers that it was on, and the backups had failed. And so we had 3 weeks where we actually had to go back to paper charting, and we had everything prepared. So we had forms, and people were out doing paperwork and taking care of the patients. Now, one of the other challenges we had is that if you don't have any electronic medical record, we were set up for electronic billing. And so we weren't able to get bills out the door either. So
oh my gosh,
we had people in our office working 18-hour days trying to put things back together. And one of the things that we found is we were actually able to gather information, because every computer system had a cache of some data on it. That was so that it would run faster. And so we were able to gather all of those computers together and all of that data, mash it into the database that had failed, and recreate our entire system. And we ended up only losing 4 lines of data from patient records, not a full record, but actually 4 visits that had been done. So we were able to recreate almost the entire thing, and then put all of that information that had been done manually into the system. But it was an all hands on deck kind of situation where we said, everybody, if you don't do this, then our company will fail. We can't do this without you. And so everybody pitched in, and they said, we're going to do this. This company matters to us. And it was a great, I mean, it was terrible, but at the same time, it was a wonderful way that to see our team come together like that in a way that was totally unexpected.
That's scary, and sounds like something that is just no business ever. I don't think a lot of businesses actually planned for that. I'm not sure if you really did. You probably just got lucky, to be honest, right? Mm-hmm. But it was your approach with your employees that kept your business alive.
It was.
And you had those employees that literally were willing to work those 18-hour days to go back in time 75 years to start doing things on paper until you got up again. What were some of the biggest lessons out of that experience?
One lesson was have better backups.
I knew you were going to say that, Beau.
And another lesson that we learned was the power of asking people for help. It's so often we want to say, everything's fine, we're good, and put up this wall that says, I am perfect, you don't have to worry about anything, I've got this. However, that puts distance between you and everybody else, because one of the ways that we connect as humans is by asking for help and by having these shared experiences that you can't have when you put up that wall. When we asked our staff for help, we could have said, you know what, we're going to try to do this. We would have failed, but we could have done that. Instead, we were transparent and we said, listen, I know this is scary. You may not have paychecks if we don't get this done. Help us get this done so that we can pay you, so that we can have a business. And when we opened up like that, things really fell into place, and people did things that we never thought that they would do. And it created a much stronger connection in our organization than we ever would have had that not happened.
So in your vulnerability of saying that, right? We don't know what to do, but we know we're going to need everybody's help. Were you able to get suggestions and assistance and help from employees you didn't necessarily think you'd get it from?
Yeah. We were able to have people say, hey, here's a way that we can do this better. Here's, and I mean, a lot of it was, here's manual work that, like, right now we're just doing that. And we had people who said, okay, I will just do this manual work. But we also had people say, here's how we can do this quicker so that we don't have to work 18-hour days forever, so that we can shorten this time frame and get that money flowing again. And so, yeah, people had great ideas. People pitched in and said, hey, I'm going to bring food for everybody. And just did unexpected things that made a world of difference to everybody who was helping on that project.
Were you able to identify different roles for those people through this experience?
We were. The people who really stepped up they ended up with different roles. They were ones that we said, we want you to be a leader. We want you to come in and do more with our organization, because you're the kind of person that we want to keep around. And there were people that didn't pitch in, that said, this is not my wheelhouse, I'm not going to do this. And those are the people that we said, you know what, we may want to look at replacing you, because we found all these great people here and we found you over there who said, I'm good, I'm not going to do anything. And because it's not in my wheelhouse, even though you had more to give. And it's not saying that if you didn't pitch in and do 18-hour days, you're fired. But it is to say that when we looked at it and we looked at the attitudes of the different people and who was willing to pitch in and how they were willing to pitch in, it certainly informed what we did going forward with the staff that we had, and said, do we want to look at new people, or do we want to, who do we want to expand? Who do we want to say, why don't you find another opportunity? And who do we look at and say, maybe we need a different role for you because you're being wasted in this role?
Yeah. So that emergency challenged your culture, but yet strengthened it at the same time.
Yep, absolutely.
That's incredible. Beau, this has been a fantastic conversation. Is there any pieces of advice or words of wisdom you can share with our podcast audience before we sign off here?
Yeah, one of the things that I think that is undervalued in business is trust, and trust comes through a variety of different areas. There's trust that is from the things that you do, knowing that you're competent, knowing that you know what you're talking about. There's also the trust that is built through interconnection and through building those bonds with people. And I would just say that trust matters so much in business. And I certainly see that in healthcare. But I think in any business, if you have somebody that you trust, you are more likely to do business with them in the future. And so I would say, build that trust, work to become more human in business, because it is so easy to just have everything be a widget and say, okay, I need to get more widgets out, and I'm going to replace this cog here because it's more effective or more efficient. And we look at efficiency as opposed to effectiveness. And so I really would encourage people to look at that trust and say, how can we build our trust in our organization? Because that is something that will unlock untold energy and reserves in your company, and it'll make you so much faster than if you had just said, well, we're going to keep throwing this in, because mistrust is like sand in gears, and it just causes everything to break down. So use that social lubricant of trust, and really you'll find amazing things happening in your organization if you do.
I think that's a perfect way to end our conversation, Beau. Lean into technology, stay humanly connected with your clients, your patients, and especially your employees, and drive those customer and client relationships through trust first, and your business will thrive.
Absolutely.
That's great. Well, Beau Sorensen, Chief Operating Officer for First Choice Home Healthcare and Hospice, thank you so much for joining us on the Think Small podcast today. We really appreciate your time.
Okay, great to be here. Thanks so much, Rob.
Welcome to the Think Small podcast, hypergrowth for small businesses. So, what's slowing you down?